Thanks for inviting us in. We want to begin with good news tonight. COVID cases continue to decline across the state of Indiana, and that means relief for doctors, nurses, and hospital staff. So tonight at 11, we want to start our big story with this inside look at how COVID hospital wings are now operating now that they're not constantly overwhelmed.
On floor B7 at IU Health's Methodist Hospital, it's busy, but it's nothing compared to 2 years ago.
There was so much fear and so much uncertainty in the beginning.
As soon as the virus hit, the hospital began dedicating certain COVID floors. Dr. Warren Gavins was one of them, saying at the time it was difficult because little was known about the virus.
You had no idea how to test. You had no protection in the form of a vaccination yourself personally, and you had no solid treatments that you could believe in yet.
At one point, all 24 beds on the floor were occupied by COVID patients, with yellow carts lining the hallways full of PPE. And since it was a medical surgical unit, there was only a certain level of care they could offer.
There were days where, you look and there's three main hallways where there'd be a patient decompensating in each hallway. And they would be on therapies that would normally necessitate a higher level of care, but there wasn't room. And so it was a really helpless, awful feeling.
But on Thursday, that feeling was a lot more hopeful.
B7 has no COVID patients today.
No COVID patients, something Dr. Gavin has been waiting 2 years to say.
It feels really good. You forget how good it feels to treat pancreatitis and to treat these things, something other than COVID. So I miss that.
Through the many ups and downs, Dr. Gavin says it's his coworkers, family, and the many Hoosiers who've kept him going.
And to see the support, the unwavering support, and to be called things like heroes, I still can't wrap my mind around it, but it really meant a lot.
And as the pandemic continues to come in waves, the hope is it will only get easier to manage.
Could it be something that we're going to have to live with? Yes, that's very possible. And so I also hope in that regard that if it's something we're going to live with, that we're much more equipped to deal with this.
For now, Dr. Gavin and his team are just taking it one day at a time.
Right now, the number of COVID patients in Indiana hospitals is down considerably across our state. This is really good news. Currently, we've got 354 Hoosiers hospitalized with the virus. That is a dramatic drop from the 3,500 patients that we saw just a couple of months ago. Currently, countries like the UK are seeing COVID cases climb again because of this subvariant of Omicron called BA2. And what happens over there tends to play out here about 2 to 3 weeks later. While Dr. Anthony Fauci says this current strain of COVID may lead to an increase in cases, he says that doesn't necessarily mean we'll see a surge.
It's a very interesting situation where the cases are going up, but it does not at this point in time appear to be any degree of severity.
So far, it seems this subvariant is more contagious than Omicron, but does not necessarily lead to a more serious illness. If you'd like to take a look at Indiana's COVID case tracking, things like positivity and hospitalizations, even ICU bed availability, just go to WTHR.com/coronavirus.